Hello, welcome. Today we are with ENT Specialist Dr. Veysel at Turkey Cares, and we're going to talk about his professional life a little bit to get to know him better. Hello, Dr. Veysel, welcome. First of all, how are you?
Thank you. Thanks, I am good. What about you?
I'm very well, thank you. So I would like to ask you a couple of questions today to get to know you better and to our patients get to know you better. Our first question is to you, how did you decide to pursue this profession?
Actually, it wasn't a difficult choice for me because in my family there are many doctors. So my uncle and my cousin or my other uncle, they were doctors, so they were a good impression for me, and so my parents also wants to being a doctor for me. So it wasn't a difficult choice, but when I got a university exam, I was a little bit thinking about engineering or something, another jobs. But end of the results, I made my choice about being a doctor.
That's great, actually. Are you happy with that?
When I was studying in medicine faculty, to be honest, no. But nowadays, yes, I really like this job.
So our second question is, was there a specific reason to choose ENT specialist, to be an ENT specialist?
In our medical faculty, we have some internships. So first month, for example, 1 month to ENT, we spend time in ENT and neurology and internal disease or something like that. So when we got with my groups to neurology internships, there was a professor in right there. So one day he asked me, just spontaneously, he asked me, Veysel, you will be an ENT doctor? So I was shocked because before this neurology internships was an ENT, and I was really impressed from the department. So it's kind of, the sounds coming from the earth for me. So I was really impressed for his words. And after the exam, some friends offered me a radiology and dermatology or kind of things, but actually I really liked the ENT diseases and head and neck area, their operations and mentors or these things. So I choose the ENT, and I really happy in this department.
It sounds like a fate, actually.
Yes.
It was in your fate.
It's fate, it's destiny, I think, yes.
So thank you for your all answers, by the way. Our third question is gonna be, how was your first surgery? Do you remember it?
Yes, of course. I was a resident. It must be, I think, my 3rd or 4th month in my residency in Ege University. So I was a really young resident. So my bigger, we said in Turkey, abi, my bigger colleague, one day called me and come to OR, operation surgery, you will be performed. So it was a tonsillectomy, 4 or 5 years old child. So I performed, but I was really excited. So we did it together. It was a successful, but I always remember time of the anesthesia, and during the surgery, my colleagues always asked me some questions about the operation technique. I remember I told them, how can I answer your question? Should I do the operation or answer your questions or something like that? But end of operation was really, I was really happy, and it was a good pursuit for me.
So how do you feel now in every surgery? Do you get excited still, or it's like a habit for you now?
Actually, nowadays it's kind of a habit, but sometimes if I gonna perform a little bit, hard case or the different techniques, if I try different techniques, yes, of course, I am getting excited. But we have to be careful about the passion or being excited. It has to be a on balance.
Sure, of course.
So I am really happy.
What was the most impactful feedback from a patient that you heard?
I cannot say just one story about this, but there are a lot of good stories and moments for me. Generally, after the operation in first week, we take the disciplines and the cast. So it's in first touch, in first moment there, when they look in the mirror, you can understand what they're feeling. So a couple of times they were crying after the cast off. So I can read the happiness of their from eyes or their words. So I think that's why we are, surgeons being still happy in this area.
Actually, I was crying when I got my cast off too, so I understand the patient side as well.
Because you're happy or not?
No, because I was really happy. It was my dream, because I understand for most of the rhinoplasty patients, actually, it's their dream, because every time you look in the mirror, we see something, because it's obviously, it's, in our face. So I'm crying too, so I'm really thankful to you to get this job and making people dreams come true.
Yeah, that's true. Actually, not only rhinoplasty, all of the facial plastic procedures, we can put this topic inside of this topic. So I hope all patients or doctors will be happy after this operation.
Yes, sure. What would be your suggestion to young doctors who started this profession, or the ones who is considering to be a doctor?
Actually, I suggest to young doctors or young surgeons to just keep push and update their knowledge and keeping to just follow the updated mentors, or being a part of the academies, and even in Turkey or international, there are a lot of academies. As much as possible, join to meetings, and so it's really important. And our community is not too small, on the other hand not too big, so we have to keep in touch with ourselves and in this community. So one day maybe you need to ask something to your mentors, your friends, your colleagues, or something like that. So to keep networking good and follow the mentors and join the meetings and update your knowledge, it's really important. So there is no doubt you will be successful.
Thank you so much for being a part of our family at Turkey Cares. We are very, very happy to have you here, and we're very excited to work together.
Thank you very much. It's my pleasure. Thank you.
Thank you. See you on the next videos.
Bye bye.
Turkey Cares, because we care.